Do you think you might have damaged your knee replacement? If you recently suffered a fall or were in some sort of accident, like a car accident, bicycle accident, maybe you tripped at home over a rug, or you tripped over a pet and you tweaked your knee and you're concerned about it, then you may have damage to your knee replacement. You may not, and you may recover just fine. But I'm gonna tell you in this video 3 clear signs that you may have damaged your knee replacement. The first is if you have a loss of function in your knee. Like you all of a sudden can't straighten it out all the way or can't bend it all the way. Even if it's a small loss, that's something to take into consideration. Now it's possible that that motion will come back, but in the moment right now, you've got to just note that and make sure, compared to what you were bending and straightening before, so that you can know if you had a loss of motion. Number 2 is swelling and pain. And I'm talking about lots of swelling and pain because it's possible that you banged your knee, you actually got hit somewhere on your knee and you have like a goose egg, a bump or a spot that is swollen and painful. That doesn't necessarily mean that you damage your knee. It could, but it's less likely. What I'm talking about is diffuse swelling and pain, like where the whole knee swells and is painful. It's going to limit your motion as well when you have that. In that situation, you need to be concerned that you possibly have damaged your knee replacement. Now, number 3 is the most important one. If you don't feel like you're improving day to day, like if you had an injury, you're probably going to take the day off. As far as moving around, you're going to get help with getting around. You're going to get on your walker or your cane again. But as a day goes by, 2 or 3 days go by, if you feel like you're not improving, the swelling isn't going down, the pain isn't going down, the function isn't coming back as far as being able to put weight on your knee and bending and straightening your knee, then there's serious concern that you may have damaged your knee and you need to go talk to your surgeon or go visit the hospital, whichever is appropriate for your situation. Now, if you are having improvements, like it's getting better day to day, that's a good sign. That means you probably just had a temporary injury and you're going to recover from it. But where you've got to be cautious is if your improvement plateaus. If you get better for 3 or 4 days and then it's overall better, you're moving better, but there's still some swelling, there's still some pain, but the 5th, 6th, and 7th day and so forth are about the same. You're not really improved from there, then that's a concern that you might have some small damage in your knee joint and you should go talk to the doctor or maybe get some x-rays and see what they want to do. It's possible that you don't need to have a revision surgery done, like have the knee replacement done over again, but it's possible that that might be the best situation for you as well. You need to go talk to your surgeon to see what needs to be done. What's most likely is that you just had a sprain or a strain to your knee joint and you're going to recover just fine. If you're plateauing and you've been checked out by your doctor and they said everything's just fine, then there's a chance that you can run into having chronic knee pain and you've got to address the problems that are underlying in order to get rid of that chronic knee pain. I've got help for you on fixing chronic knee pain here on this channel. Go down into the description and I've got a playlist of all our videos. It's called the Failed Knee Replacement Help Playlist. And I've also got a program called the Failed Knee Replacement Recovery Program. You can learn more about that in the link in the description below. Thanks so much for watching. Please share this video with somebody you think needs to hear this. Give it a thumbs up if it was helpful. And don't forget to subscribe and turn on a notification bell so that you don't miss out on any of the helpful videos we post each and every week. I'll see you in the next video. Bye-bye.